there will be a strengthening of research and policy decisions once a national cancer registry is made. It will also boost funding. It's important to note that the Parliamentary Standing Committee on Health and Family Welfare recommended that cancer be classified as a notifiable disease. Representatives from IMI, IME and ICMR who have come together to support, some leading oncologists and healthcare professionals who are with us today, and others partners and stakeholders in oncology care. Our campaign, which is called United to Notify, reflects this unified stand that cancer care is not just an individual fight, it is a collective responsibility, and together we must come and create a transformative shift in cancer detection, treatment and policy making in India. And with this, I urge every doctor, every healthcare worker, every researcher and citizen to raise their voice in support of this initiative. Let us ensure that no cancer goes unnoticed, no patient goes unsupported, and no opportunity to save lives is lost. Let's stand together, speak together, and act together.
Today is World Cancer Day. Union for International Cancer Control is an international body which is the largest and oldest global organization dedicated to cancer and its eradication there. 4th of February every year has been our mark to celebrate World Cancer Day, making it an awareness to the public and to the stakeholders to take charge the whole year what they have progressed to eradicate, control and bring happiness to the cancer patients. The World Cancer Day is an initiative against the cancer where the entire world unites together to fight against the global cancer epidemic. It takes place every year on 4th of February. It encourages cancer prevention, detection and treatment by raising awareness about cancer. It also presses the government all over the world to take action against the disease, public awareness, and along the social media have to build more opportunities to expose and global awareness about the impact of this disease on the government and the public health, thus enhancing the cancer services accessibility, reducing incidence in cancer, mortality, and finally the phrase called as smile of cancer survivors.
Will not translate to having a paradigm shift in the way cancer is managed unless you first identify the disease, you understand the cause for it, and you also create after notification a registry and do something to reduce the burden of cancer, because you are frankly doing what is called as a fait accompli or a post event, where you actually set up something to keep treating people rather than taking steps to find out ways to reduce the burden of cancer, in some case eradicate it, and in some case prevent it from vaccination. So one of the things we've taken up, well, there's another discussion we could have on the Made in India indigenous cervical vaccine program, and why shouldn't a larger universe of people who can be vaccinated get vaccinated when there are third world countries, as far as one in Rwanda, which has got a vaccine policy for cervical cancer covering their entire population, and developed countries like France and US which has a cervical cancer policy. Notifying means that we get to know that India has a single policy when it comes to cancer, rather than leaving it to the interpretation and implementation of the state. Currently it's divided. Some states have a voluntary cancer notifiable status, some of them do not have it notified, and some of them are trying to take steps to get it notified.
Genetic mutation is caused only 10%, and most of the other 90% factors is environmental factors and lifestyle factors. I myself am a longevity and lifestyle coach. I do a lot of webinars on how to adapt a healthy lifestyle. So when you look at recently, even cancer is also labeled as a lifestyle disease. So if we take precaution, we can, most of the cancers are preventable and most of the cancers can be cured. So as Sir rightly said, we have to notify, and first we should have that, create the awareness among the people. There is still a social stigma and fear around the cancer. Many people think that if they get the cancer, they die. And there is a lot of emotional, psychological, the financial and the physical burden on the family, on all also the patient. So prevention is better than cure. So we can try to adopt a healthy lifestyle and we can prevent many cancers. So I have done a lot of webinars on this, online webinars and even physical seminars. Even in the IMA I have done public guest lectures regarding creating the awareness to the people about healthy lifestyle. Even I am the member of Indian Society of Lifestyle Medicine.
You all know today is the World Cancer Day. So we all assembled here to spread the awareness about the cancer. You know, the cancer is the leading cause of death in public in India and abroad. Especially it is affecting pediatric, children also. So it's quite alarming that it is affecting the children also. So in this context, we all should come together, corporate bodies and government and medical practitioners should come together to form a formula so that it will reduce the burden on the cost of the treatment. So the main aim of this awareness campaign, you know, the cancer treatment is very expensive. It may be chemotherapy, it may be radiotherapy, surgery. So since it involves huge burden on the socio-economic status, so it is our main concern is to bring down the cost of the treatment. And next important thing is prevention. We should aim towards the prevention of the cancer occurrence. So we should curtail at the very beginning. We should do the screening of the patients at the primary health centers and at community level, so that early detection is very important. So that will take us towards a long way in curing the cancers. And next important step is policies. The government should formulate a policy so that even the corporate and private bodies should cater this treatment at the affordable cost.
So the cover disease around the World Cancer Day. Thank you all for coming together. And I think we need to understand one thing, that we are in the middle of a cancer pandemic. There is no question. 14 lakh cancer diagnoses happen in India per year. Of the 14 lakh, the vast majority, about 8 lakh people die from cancer. This is one of the highest mortality rates we have compared to the Western world. Where a significant portion of the cancers are cured. And the reasons why most of our patients die, we have anecdotal evidences that maybe because they're present late, maybe they're not aware of the diagnosis, or maybe the incidence level is quite high. But these are anecdotal evidences. We don't know for sure because we don't have accurate data. We have independent people trying to make cancer registries. We have some from Karnataka, some from other states, but we don't have a national database. As clinicians, what I know is that maybe gallbladder cancers are more common in North India, stomach cancers are more common in South India. But do we have a policy for that to identify what causes these cancers and at what stage they present? We don't. We know that the best way to reduce cancer burden is to prevent cancer from happening in the first place. So when we start talking about cancer, causes of cancer, infection is one of the most important causes of cancer. And we fail to understand it. We talk about tobacco, we talk about alcohol, and they are important causes of cancer. But we fail to understand that infection is also an important cause of cancer. Hepatitis B and C causes liver cancer.
Indian Medical Association, Bangalore branch, is celebrating the World Cancer Day, that is 4th of February 25. Today we had a walkathon in the premises of 2 kilometers, making a public awareness about the cancer to the public at large. Then we had many hospitals, like Victoria Hospital, KIMS, Srinivas Hospital. There we had a cancer screening program and vaccination administration. This was part of the Indian Medical Association program today. Apart from that, the Apollo Hospital and in association with IMA Bangalore branch wanted to say this world, especially the government of India, that please notify this cancer as a notifiable disease, which has a lot of advantages to the public at large and the medical fraternity in general. So this is where today we had a press conference to have the government of India to notify this cancer, where we can have a larger registry and easy way of treating the patients, and the post-care modalities, programs can be worked out. This is where we stand today.
ಇವತ್ತು ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇ ಅಸೋಸಿಯೇಷನ್ IMA ಮತ್ತು ಅಪೋಲೋ ಕ್ಯಾನ್ಸರ್ ಸೆಂಟರ್ ಅಸೋಸಿಯೇಷನಲ್ಲಿ ನಾವು ಈಗ ಗೌರ್ಮೆಂಟಿಗೆ ಒಂದು ವಿನಂತಿ ಮಾಡ್ಕೊಳ್ತಾ ಇರೋದೇನು ಅಂತಂದರೆ, ಸೊ ಕ್ಯಾನ್ಸರ್ನ ಒಂದು ನೋಟಿಫೈಯಬಲ್ ಡಿಸೀಸ್ ಆಗಿ ಮಾಡಬೇಕು ಅಂತ. ಸೊ ಕ್ಯಾನ್ಸರ್ನ ನೋಟಿಫೈಯಬಲ್ ಡಿಸೀಸ್ ಮಾಡಿದ್ರೆ ಅದರಿಂದ ತುಂಬ ಅನುಕೂಲ ಆಗುತ್ತೆ. ಏನಕ್ಕೆ ಅಂತಂದರೆ ಎಷ್ಟು ಜನ ನಮ್ಮ ಬರ್ಡನ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್ ಎಷ್ಟಿದೆ ಅಂತ ಗೊತ್ತಾಗುತ್ತೆ. ಇದರಿಂದ ಸೊ ಮುಂದೆ ಏನೇನು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು, ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಕ್ಲಿಯರಾಗಿ ಮಾಡ್ಕೊಳ್ಳೋವಂಥದ್ದು, ಯಾವುದೇ ಮುಂದಕ್ಕೆ ಯಾವುದೇ ಉದ್ದೇಶದಿಂದ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು ಮತ್ತು ಇನ್ಫ್ರಾಸ್ಟ್ರಕ್ಚರ್ ಯಾವ ಥರ ಡೆವಲಪ್ಮೆಂಟ್ ಮಾಡಬೇಕು ಅನ್ನೋದು ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ಎವ್ರಿ ಪೆನ್ನಿ ವಿಚ್ ಈಸ್ ಯೂಸ್ಡ್ ಶುಡ್ ಡೆಫಿನೆಟ್ಲಿ ಸೇವ್ ದ ಮಿಲಿಯನ್ಸ್ ಆಫ್ ಪೀಪಲ್. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ನೋಟಿಫೈ ಮಾಡಬೇಕು ಅಂತ ನಮ್ಮ ಉದ್ದೇಶ.